Planning enhances performance. If you plan for a journey, you're sure going to get the best out of the journey. Juliana Ome is the name. Preconception care is the topic. You might want to ask, how can I make my pregnancy a smooth ride? Or how do I have a great 9 months experience? The answer is preconception care. Preconception care, hibernate the word. Pre means before and conception means pregnancy. So preconception care means care before pregnancy. By way of definition, preconception care is a set of specialized form of care for women of reproductive age before the onset of pregnancy to detect, treat, or counsel them about any pre-existing medical and social conditions that may hinder safe motherhood and the delivery of healthy baby or babies. Why is preconception care necessary? First, is to take care of any preventable conditions that may complicate pregnancy and childbirth, like maternal undernutrition, iron deficiency, anemia, mother-to-child transmission of HIV and AIDS, or other infections that grossly affect the development of a fetus. Remember, the most critical phase of fetal development is complete by the time most mothers are aware that they are pregnant and then plan for their first antenatal care. Number 2, to help women with chronic diseases like hypertension, diabetes, asthma, sickle cell anemia to become and stay pregnant in as healthy a condition as possible. 3, to screen for the presence of possible harmful substances to the developing fetus, things like smoking or excessive intake of alcohol. Number 4, to help parents who are anxious because of maybe previous pregnancy, a previous bad experience, or because of an existing genetic condition and they are anxious of what will be their fate. So you should go for preconception care. Then what should you expect from a preconception care? There are 3 basic things. Number 1 is education on any expected lifestyle modifications, only adjustment on your nutrition, then folic acid supplementation to prevent neural tube defects and other diseases, then counseling. Top on the list is genetic counseling. You should expect genetic counseling when you go for preconception care. Genetic counseling for sickle cell anemia, cystic fibrosis, any condition that your child may likely inherit. Then treatment and control of transmission of HIV and AIDS and hepatitis C viral infection. In fact, you know what? A HIV positive mother can have HIV negative baby. I promise to make a health talk video on this particular topic because we can save our future generations from HIV and AIDS. Yes, we can, mothers. We can. Then treatment of sexually transmitted infections that already exist, like gonorrhea, chlamydia. These are things that can grossly affect your baby when your baby is born. But if you come and get a clean genital tract, why not? Then treatment of other viral infections, or what we call touches infections. Toxoplasmosis, rubella, cytomegalovirus, herpes simplex. Then the treatment and control of any other condition at all, because it should come, because some people are asymptomatic carriers. You may feel all right and healthy, but your health is not at its optimum state to house a baby. So you should come, get yourself checked, diagnosed properly, and if it's something we can treat and take off, we'll do that. If something we can control, we'll do that. Then immunization services, especially for vaccines that are not safe while you're pregnant. These you ought to take before you become pregnant. They are mainly what we call live vaccines, like rubella, varicella, hepatitis B vaccine. These are vaccines you should take and get your immunity intact before you get pregnant, so that the immunity can be transferred to your baby. Then clinical examination and assessment. This is the third thing you should expect, and it entails proper history taking and diagnosis of any underlying disease conditions like thyroid diseases, dental caries, hypertension. Then identification and adjustment of any prescribed medications that you are on that may cause adverse effects to your developing fetus. These are things we call teratogens. For example, if you're a mother and you want to get pregnant and you're treating acne with isotretinoin, for example, it is a teratogen. It's a legally prescribed drug though, but for a baby that's growing, it's going to affect baby's development. If you're hypertensive and you're on certain antihypertensives, there are some that are not healthy for a developing fetus. You should see your doctor and then get your dosages adjusted before you get pregnant. If you're treating maybe DVT with something like warfarin, it's not healthy to be on that drug and get pregnant. All you need to do, just come to your doctor, come with your prescribed drugs, and your doctor will look at it with you and you plan, okay, madam, or, you know, to your partner, this is what we should do, this is what we should adjust. It's something that you would thank yourself for if you go to do that. Then, if you had a bad previous pregnancy experience, maybe you had a condition that was really perturbing, you can come and get counseled and see your doctor and know if it's something that we can prevent. Why not? You prevent it and you have a smooth ride in your pregnancy. Who should go for preconception care? First-time pregnancies, other-time pregnancies, intending parents, subfertility issues, any couple that wants to get pregnant should go for preconception care. When is the best time to go for preconception care? From the concept of preconception care, we're trying to get the best from pregnancy, right? So the best time is long before you get pregnant, especially for services like immunization services, so that you get vaccinated and the immunity will be, must have taken place before you get pregnant. Then next question is, where can I get this pregnancy care, Juliana? Every time preconception, where do I get it? Any hospital at all that offers maternal and child health care services. Obstetric and gynecology specialist clinics, any hospital at all you need to do is to walk in and, any hospital around you, walk in and ask for preconception care. If they do not offer the services, they will sure direct you on where you should get such services. I want to end this session with this quote by Sun Tzu. Plan for what is difficult while it is easy. Do what is great while it is small. Trust me, you don't know how far planning for your pregnancy can go until you undergo a preconception care. You see that pregnancy can be a smooth ride and a great experience. It's like going ahead of time. Planning enhances performance. Once again, thank you for tuning in and for staying in to learn. I believe strongly that having the right knowledge will help you to make the right and an informed decision. Because if you know better, you will surely do better. Remember, every mother has the right to life while giving life to another. Feel free to use the comment section for your questions, contributions, and comments. You don't want to miss any information that I'll be dropping in that will be useful to you and your loved ones. So stay tuned to my network. Stay connected to my network. On YouTube, Facebook, and LinkedIn is Juliana Ome. Yeah. On Instagram is juliana.ome. Thank you once again and see you again.